Hi Sam, so we're just going to go through how we suction a tracheostomy patient. Dave looks like he needs a suction at the moment. He is coughing and is dropping his saturations a little bit to about 92%. Sam, do you know any of the precautions that we need to think about before suctioning Dave?
We need to consider if Dave is hypoxic, unless it's due to secretion retention, if he has any cardiac instability, any cerebral edema, or any clotting disorders.
I can confirm that Dave has none of those things so that we can prepare to suction him. So what equipment would you like to prepare or have in your bed space?
I would like to have Dave's emergency trachea box, all my emergency equipment, so oxygen and suction. I would like to have a sterile suction catheter, the suction set to an appropriate pressure for his age, my appropriate PPE, gloves, apron and a mask, and some sterile water to clean the suction tubing afterwards. Dave has a size 5 tracheostomy, therefore I have prepared a size 10 French suction catheter, and I will suction down to 8 centimetres, as it says on his bedside information.
So now we've prepared all of our equipment, we're ready to start suctioning Dave. During the procedure, we must monitor him continuously, paying particular attention to his respiratory rate and quality, the colour of his lips and face, his heart rate and his oxygen saturations. Okay Sam, so I think we're ready to start giving Dave a suction now.
Hi Dave, my name's Sam, I'm the nurse looking after you today. I'm just going to start suctioning your tracheostomy now, okay?
Okay Sam, so if you peel back the top of the wrapper and connect the port of the suction catheter to the suction tubing. I'm going to turn the suction on for you, making sure that it's set at an appropriate pressure for Dave. Using a clean technique, withdraw the suction tubing from the wrapper. Do not allow the catheter to touch anything. If you do, that's fine. We can dispose of that one and get a new one. Now we're ready to remove the HME filter, and we are going to insert the suction catheter to 8 centimetres. Once you're at 8 centimetres, apply your suction. And because Dave is a child, we can take about 10 to 15 seconds to withdraw the suction catheter. Now we're done, we can reattach the HME filter. And we want to disconnect the suction catheter from the tubing and dispose of it in a clean fashion. We can now assess Dave to see if he needs another suction. Do you have any questions about suctioning a tracheostomy?
Yes, just one. What determines the length of time it takes to suction a patient's tracheostomy?
So in general, we need to think about the size of the patient. So for neonates and infants, withdrawal shouldn't take more than around 5 seconds. For children and adolescents, withdrawal shouldn't take more than around the 10 to 15 second mark. But we also need to take into account other factors like the stability of the patient, their reserve, the thickness of their secretions, and whether they'll tolerate repeated suctioning. So now we have done one suction on Dave, we need to reassess him, see if that has helped, and perform any further interventions as necessary. This might be another suction, we might need to give him a nebulizer, we might need to increase his oxygen.